The U.S. supply chain for critical medical supplies is an unfixed and increasingly consequential national failure. The federal government has not been able to get it together to make it any better. But you confront the pandemic with the government you have, not with the government you might wish to have. And this is who we've got. Given that, could the medical supply chain crisis get better? Could it get better for PPE? Could it get better for high-tech supplies like ventilators? Are there things we could do even now to ramp up the access to the most critical supplies, specifically for the hospitals and the health workers who have the most acute need? Joining us now is Donald McNeil, science and health reporter with the New York Times. Mr. McNeil, thank you very much for coming back. It's good to have you here.
Thank you for inviting me. The answer to your question is, I think, is yes, even for ventilators. I'm not so worried about nationalizing the supply, because that sets off alarm bells. It's more, I had a text from a friend of mine this morning in San Francisco, who's on the board of UCSF, and he said our hospital has more than enough ventilators. We're not seeing the surge of patients. Thank goodness for the early moves by the mayor. And I said, wait a minute, we're dying here in New York. If you don't need those ventilators, how about lending them to us? And then had the thought, he's not alone. There are hospitals all over this country that are right now not facing surges of patients, while New York and New Orleans and Miami and Detroit and a few other cities are facing Armageddon. And because we're all in lockdown, pandemics cross the country in waves. And this has slowed down the wave. Instead of hitting every city at once, the way it was going to a little while ago, now it's going to go slowly from city to city. So I think it would make a lot of sense if the Pentagon basically was allowed to take control of all the ventilators in the country that are now being carefully hoarded by hospital owners because they're worried about a future problem, and treated as a big sort of lending library run by the Pentagon. They have the planes to do it, move them around to the cities where they're needed. When those cities get over their humps, their peaks, then they can be moved to the other cities. And you could have a great sort of shifting of ventilators around. It's going to require federal intervention. It's going to require something like, treating ventilators as sort of special federal goods the way heavy machine guns are, or something like that. That you're not allowed to, well, generally you're not allowed to own, but at least you wouldn't be able to hoard them. And then they'll be moved around during the duration of the pandemic and then returned to their rightful owners when it's all over. Because the option right now is not really great. President Trump said today that we've got 50,000 ventilators on the way, but they're not going to be available for 100 days. And we don't have 100 days here in New York. We've got 2 weeks, and they only have less than a week in New Orleans. So this might be a way to handle this. I know it's going to make the Hannitys and the others on the far right go, this is Obamacare uber alles, and this is a disaster. But it's going to save lives, maybe thousands and thousands of lives. And a lot of those lives are even going to be of people who are of advanced years and maybe have some obesity problems and might blame Donald Trump for the loss of those lives. So I don't think it'd be bad policy if we did this for a little while.